Good morning. I'm Dr. Marilyn Crabtree. I'm a family physician at the St. Lawrence Medical Clinic in Morrisburg, Ontario. I've been working in the Eastern Ontario region for nearly 30 years at this point. Been involved in family practice in the office setting as well as in the hospital, and have had ongoing challenges over the many years with dealing with complex patients. Recently, I've been involved as a primary care network co-lead in the Upper Canada region and involved directly with the Upper Canada Health Link. The Health Link is primarily to provide a care coordination program for patients who have high needs for both medical and psychosocial as well as mental health issues. The big advantage is that it provides a backup support to the care that a family physician who is currently doing all of that care coordination, and gives them the leeway to actually focus on more of the medical care. I've had a few patients involved in the Upper Canada Health Link, and these patients have benefited primarily in the sense that they now are hearing one voice from the various providers in their circle of care. For example, the cardiologist, the nephrologist, myself, and perhaps any other specialists are now feeding information into one program, and there is someone actually sitting at a desk somewhere managing that coordination, and also providing that information back to the patient so that he or she feels that they have some control, which has definitely helped patients who are feeling lost in the shuffle with their medical care being so difficult, and trying to manage all of the various visits and all of the various communication pieces between their specialists. So at this point, the question would be, why should a family physician or any other physician or primary care provider become involved with health links? And I think the issue is primarily to assist us, because we all went to medical school to provide the medical care, but we are certainly not social workers, we're not care coordinators with CCAC. And while we've taken on those roles, they're certainly not our area of expertise, and we're certainly not remunerated very well for any of that program. The best piece that I have had is with one patient where I was able to provide a home visit at a mutually convenient time for both myself and the family, as well as the care coordinator. And we sat down for approximately an hour where I was able to bill a home visit and actually discuss the whole plan with the family and make sure we were all on page or on the same page with what the patient wanted and what the care coordination plan had recommended. And it worked out very well because I was able to see their home environment. I was able to understand where their challenges are within the family dynamic, and also see directions that we could take in terms of optimizing some of the medications and other treatments to manage this man's symptoms. And therefore, I feel that the patient actually gained quite a bit, because he was able to see that everybody was working together to manage his healthcare needs, but also the family felt that they had other people in the circle of care that actually understood the complexities that were involved in managing this man's case. So in conclusion, I'd encourage physicians to discuss health links with their patients. I think particularly if you're struggling with someone who's got complex health needs, I think most patients would be interested in at least discussing the various options that Health Links has to offer. The paperwork is minimal, and the potential benefit for yourself in decanting a lot of that extra work is definitely worthwhile. And because you're able to bill for visits, it's something that you certainly can get remunerated for at a better rate than you're getting right now for all the office work that you're doing.